TOMO Global Health is a mutual learning program for healthcare students where we together aim to enhance soft skills such as like teamwork, leadership, and then critical thinking skills.
Everyone, I'm Kevin Oria. I'm from Kenya. I have a master's in community health and development. I'm very much interested in public health situations.
Good morning, good evening, everyone. I'm Hatsune. Please call me Hatsune or Hachi or anything you want.
As I've told you before, I'm a professor at Great Lakes University of Kisumu. So I do quite a bit of research in public health issues. The western part of the country, you can see the red part and the brown part. If you magnify it, you can see the lake, the blue color. That is where the land around the lake is where malaria is endemic, and then it spreads towards the inland. There's some socio-economic and cultural issues that need to be looked at, in addition to the control methods, in addition to treatment that is being given.
Okay. So we want to know why there is no dramatic drop in malaria cases and is plateauing in the recent years, and the healthcare staff needs to be more equipped with the proper necessary skills in order to lead huge communities to follow the guidelines and treatment measures. Another point that we went on is the lack of education. So we think that many people infected with malaria in Western Kenya do not feel ill and therefore do not go to health facilities where malaria can tackle. So for our solution evaluation, we thought that we should specify the infectious target community, and for us, we would like to target mothers and children at this point because children are typically the most asymptomatic population, and also children are like, if we target mothers who are going to give birth in a proper healthcare facility, we could, properly track their family history.
Very well done, identifying the key issues that are there. Lack of education that other groups have also mentioned. One that you have come out with, a weak health system. That one I think is very, very key. You know, regardless of what is being done, if the health system is not strong, then that will make other interventions not work. And
is what we're going to do to actually tackle the problem of malaria is that all the people we were talking is that number one, we thought it was important was to educate people about significant malaria. It seems that everybody is kind of like not okay, but kind of like they're used to the malaria situation. So we want to actually tackle educate people with the right knowledge of mortality or how they're going to impact on their life. Expert infection disease specialists, also field workers that actually know the rural area. Company developed the mosquito nest because they know how to use the mosquito nest in the right order, and include NGOs, NPOs. Maybe if they're tackling the same problem, it'll be easier to actually collaborate. And also, as I said, healthcare workers, special, and a leader of community, because some communities are really small, and the head of village is probably have a powerful knowledge to actually communicate to the people that living in a village. So we want to include that and also use the medical students because from Lucy's, I think, knowledge, people in Kenya are kind of welcome to medical students because they're...
The first mission that I've come up with is creating of awareness that ensures the reduction of malaria in endemic zones. And then the explanation under that is when knowledge and skills are spread about IRS, then when knowledge and skills are spread about IRS, then the vulnerable groups, that is the under 5s and expecting mothers, can protect themselves from malaria.
Okay. I think this is also great for part of health promotion. So C-san, McLean-san, and your team, do you know about the citizen science? Okay. That's why you are very great people, make things happen. And this experience to guide you more robust leadership in future. This is a great people. This is a leadership to guide the people or friends or family members or community or the nation into betterment of the future. So I think this experiment is very, very important, and also you did very good job.
Thank you very much, Professor. That was incredibly insightful and very interesting for somebody who potentially wants to go into the field of public health. So I just wanted to say, would you say globalization is more of a force for good or for bad for public health?
Yes, that is a really critical question. And also, our, globalization, especially economy, is good for the capitalism.